Are you pregnant or a new parent looking to ensure a better postpartum experience? Or are you a birth worker looking to improve your postpartum care skills? Check out Thriving After Birth, an online self-paced course by me, midwife and educator Tanya Tringali. It's 10 and a half hours of video content featuring experts in lactation, mental health, pelvic floor health, pediatric sleep issues. You also get worksheets and a workbook, as well as options to have a one-on-one session with me. Sign up at motherwitmaternity.com/thriving, and let's improve postpartum care together. Welcome to Season 2 of the Mother Wit podcast. I know you've gotten used to me talking about postpartum in lots of different ways, but postpartum. But this season we're going to shake it up a bit, and we're going to get started talking about something on the complete other side of the spectrum. My guest today is Chantel Zapata-Pray. She is one of the original Mother Wit clients. We started working together in December of 2018 on preconception care, and I'm so proud to say that although we are on a hiatus from our work together, we have had a long working relationship that will likely move through many phases of both of our lives. But I'll let her tell her own story. Anyway, before we get started, I want to be sure to frame the conversation for you, because I just threw out a word, preconception care, that I'm not sure if it's something that has become common enough in healthcare, despite the hard work of midwives and others, to incorporate this practice into relevant discussions with our clients. So, what is preconception care? In my own words, not from a textbook. Preconception care is healthcare focused on one's health and wellness, provided with the explicit purpose of improving health of a birthing person and their baby before they're pregnant, okay? So Chantel is unique in that she came to me with this explicit request, but the truth is that most people don't know how to prepare or even ask for this type of support. And while it's fairly commonplace to schedule an annual exam, let's say, it's not at all common to say, I'm planning a pregnancy in about a year and I want to make sure I'm tip-top. So we midwives and others squeeze this in wherever we can into whatever visit people show up for, be it an annual exam, which is probably the most common, or sometimes into a minor problem exam. The problem is, I think it's still imperceptible to our clients and society at large. And I would argue that even though I provide this care, I've not contributed as much as I would have hoped to an improved utilization of it, because I've been so focused on postpartum care. And I have my reasons for that, which is a whole other episode and technically a whole other podcast. But I'm happy today to be reminding myself of this, because I truly love providing this kind of care. I think I'm really good at it, but also it's some of the most rewarding, because I get to watch people meet their goals and have their dreams come true. Likewise, though, when it's not so smooth, I'm still honored to hold space for people to grieve the loss of an ideal and support them through finding another path forward. So without further ado, I welcome my guest today, Chantel Zapata-Pray. Oh, and a gentle reminder that nothing we discuss on this show should ever be considered medical advice. Please speak to your local provider about anything that comes up in this show that resonates with you and your needs and your health care. Hi.
Hi.
Oh my God, I've been like minutes like a child bouncing on my oh my God, I haven't seen you so long.
It has been ages. Howard, it's so good to see you. How are you?
I miss you.
I miss you too. I feel like you were like, well, I mean, I don't want to use the term besties, but like we were definitely talking like once a month, like if not more frequently.
If not more frequently, exactly. Well, that's how it always is. Doing these podcasts whenever I bring on like a former client has been a lot like this, but you are like uber special, right? Because you're like in the OG crowd, right? And we've had like a long time together. So some of the people that I talk to, you know, we had like 4 intense months together, but you and I, it's we're talking years now, which is amazing.
Years. Yeah.
Oh my goodness. So thank you so much for joining me today, Chantel.
Yeah, thank you for having me. I'm excited to talk to you.
Thank you. Thank you so much for being willing to share your story, because it's definitely different than the stories I've been sharing, right? I just said in my introduction that I tend to focus a lot on postpartum, and I do that because it's an enormous gap in the system where I can kind of interject myself without stepping on a lot of toes. Whereas the kind of care that I provided to you and that we did together has the potential to maybe step on some people's toes, and we'll talk about it, we'll unpack it a bit for everybody in a bit. That didn't happen, which is great, and I want more people to know that I do this work too, because it's such a big piece of what I think people need and something I love doing. And your story has just always stayed with me. I share it one-on-one with a lot of people, and I thought, you know what, it's time to just like get this for posterity's sake recorded and in the books, because it's a story that I'm very proud of, and I hope you're proud of your journey too. So anyway, with that said, go ahead and tell everybody a little bit about yourself, whatever you're comfortable sharing.
Yeah, absolutely. So my name is Chantel. Hello, everyone. I am a native New Yorker, born and raised in New York City, and I recently relocated to Massachusetts with my husband and my son. We bought a house, which is great because we now have more space, especially because our, one bedroom in New York City was getting a little old. So it's kind of, it's good to be up here and have that additional space. I work as a user experience designer at Amazon. My husband is an architect. And my son, he is a toddler. He is about to be 20 months old in about a week.
Awesome, thank you. Okay, so now we both have to like go into the depths of our minds. I want to start at the beginning, because I think the beginning of your story is, it just frames everything. And it frames everything in terms of, I think, the work that I'm doing, the work we did, and also just highlight some issues in our healthcare system. And that's really what this podcast is about, is kind of talking in a really open and honest way. I know I throw a lot of blame around about the medical system, but we have to talk about it. We just have to have open, honest conversations about how to make it better. And I'm trying to do that in my own weird, simple way. And I think conversations with clients and providers, where we can get other clients and future clients and providers listening, maybe debating, maybe arguing sometimes, but hopefully just hearing it and saying, wow, that's intense, that's acknowledging the truth of the situation, I think could go a long way. So that's the goal here. So, okay, start us off with what you remember about when and why you reached out to me.
Oh, yeah. Yeah. So I recall that I reached out to you essentially to kind of get a second opinion. I had just gotten measurements for my fibroids. I have multiple fibroids outside of my uterus. And my husband and I were talking about starting a family at some point. We hadn't started trying just yet, but it was something that I was worried about. And, my OBGYN at the time was like, it's no big deal. When you start, they're going to grow. When you start trying, we'll monitor it. Or you might need surgery. We'll see. We'll cross that bridge when it comes. And I was like, oh. And my primary care was an alarmist who started telling me that I should get them taken out and telling me all these horrible stories about people being in pain and bedridden and the child possibly being so squished in the womb that they were underdeveloping. So
Hey, Tanya here, interrupting with some definitions. I want to make sure everybody knows what fibroids are and a little bit about fibroids as Chantel tells this story, because I certainly don't want people getting nervous about this. So fibroids are benign nearly 100% of the time. It's something we're really not concerned about in terms of them being cancerous or anything like that. But they are essentially benign growths in the uterus, and they can dangle into the uterus. They can be embedded into the musculature, so kind of like in the middle of the thick wall of the uterus, or they can be on the outside and, not actually affecting all that much on the inside of the uterus. People can have a lot of little ones, people can have one big one, you can have a mix of them. Sometimes they need to come out. They are known for causing heavier, crampier periods, and they really can disrupt the lining of the uterus in some cases, making getting pregnant difficult. And they can also cause preterm labor because they're, in a certain sense, it's taking up extra space in the uterus for some people. So that is a short little description about what fibroids are for those of you who maybe were starting to Google as Chantel was telling her story.
I'm already an anxious person. I already can kind of go down the Google symptoms path. And I just really needed to just talk to somebody about my results and to get a second opinion. And that's when I reached out to you.
Yeah, and I mean, already one of the interesting things that you're saying, and I don't remember all these finer details, so it's interesting to hear it from you, is they gave you kind of like one side of the equation, like your fibroids are going to grow, they need to come out. But like the truth is, like, and I'm sure we talked about this, they can also shrink while you're pregnant. And that isn't always fun either, but like there's all these other options. And if I remember, like you had a bunch, but they were all pretty little. Which is really different than having like one big one inside your uterus. And I think you just said like some of them were outside of your uterus, right?
Yeah. Yep.
And the ones on the outside are not as big of a problem. So like there's just a much more balanced way we can present information to people. And I think you definitely got hit hard over the head with like a couple different presentations. And they were not in line with each other and both had their own version of alarmist, right?
Yes. Yes.
So okay, and then after we sat down and looked at the initial reason you came to me, what I remember is like I said, we need to pause for a minute. I need to take a really full, detailed medical history. And in getting to know you and all your details, I think I said, hey, I kind of think I see some things that are a bigger deal than your fibroids. Is that what you remember?
Yeah, that's what I remember too. Because my new OBGYN and I were also kind of I had started to kind of also take a look at some of my recent blood work and everything like that. And she had noted that my A1C was a little high, kind of bordering, dancing around the pre-diabetic territory, and started me on some metformin. She was like, oh, that could also be helpful in pregnancy. And she was like, here's some diet books that you could read. And, she's, disclaimer, I really like her. And I do miss her now, no longer living in New York City. But I did need, one of the things that has always been true for me as I've kind of worked on my health and weight over the years is I do need that accountability. And I think, one of the things that you initially said was, how that piece had the potential to be bigger than the fibroids. Like I was focusing so much on these fibroids that I wasn't really focusing on my holistic health and how not just the diet piece and eating right and how that could affect my A1C. And okay, now I'm taking this medication, so I don't necessarily need to worry about it as much, but how the way that I'm eating, the things that I'm eating, moving my body, and also taking care of my own mental health, the toll that all of that, when you put it together, can take on your whole system as you're getting ready to, start trying for a baby. That's something that was never discussed with me before. And that was one of the main drivers for the work that we did together.
Yeah, I mean, and it's one of the main drivers for why I started the business that I started, because it never felt right to drop a bomb on someone and then say, like, see me in 3 months. Like, here's some suggestions. See me in 3 months. In that one moment that you're saying it, I think both the provider and the client might be like, all right, got it. That's what I need to do. But then you go home and you're like, how do I implement this degree of change in my life when life is so busy, especially in New York City, right? Like these very fast-paced lives, and you get really used to takeout and fast-moving everything. And you're just like, I think, frozen solid by this idea of I don't know how to begin. And I got really tired of the way it felt to drop that bomb and then kind of forget the person existed for 3 months or more, and then just hope that they magically appeared in my office changed. That never happened. And so I know I wanted to be part of that person's change because I knew I could be. And you were one of the early people that gave me a chance to really test the theory. Okay. On that note, you and I kind of make a plan that we're going to see each other like every 2 weeks, and we're going to be in touch in between as needed. And that's kind of how we unrolled it. So what do you remember about what we started to do? How did we frame things for you?
Yeah. So I remember when we started that work, working together rather, you had wanted to kind of take an even bigger holistic picture of what was going on in my body. So looking at things like checking my thyroid numbers, and making sure, like, was that having any impact on my A1C? So, I did some additional, testing that kind of helped also drive some of the decisions that we made, but also just starting to track what I eat. I recall at the onset, you were very kind in saying, like, we're going to do this at a pace that feels right for you. And I always appreciated that about working together. But starting slow, just what am I eating right now? Like, let's not just say, okay, this is how you need to eat, but let's establish that baseline. And then let's understand how we can start making some incremental changes that are actually sustainable, and trying to find the things that kind of worked for me. And I think what I recall is that at the very beginning, we were like, we're not going to focus on, exercise at this point. We're going to focus on food. And then once we actually started putting exercise into the equation, because I did enjoy doing Zumba. So I was like, oh, let me do some Zumba. It's kind of just dancing, and just seeing the dramatic impact that actually had on my weight. And also, in working with you, I was taking my glucose, glucose readings after each meal. And we were taking a look at, what I ate versus what was happening after I ate, and trying to make connections between the foods that were, that my body was responding really well to, and the foods that my body was not responding really well to. And learning from that, but like then seeing like the impact that exercise also had on those numbers was really fascinating, I think to both of us. And that was really exciting because that enabled me to incorporate, something that I enjoy doing into our plan. So I really loved that you kind of kept it open like that, and that you made it so tailored and so flexible as we were going.
Yeah, I mean, I think what I try to do is I really try to hear people, meet people where they're at, and just find a couple changes that don't feel too painful, and say, like, okay, let's see if we can just stick with this. And if we're successful there, then we can say, all right, well, what impact is that having? Are we seeing the changes we're looking for? And it doesn't mean just weight loss, right? I want to be clear that it was never just about weight loss, but that was certainly one of your goals. And we looked at it in a very global sort of way in terms of, well, what might weight loss impact? It might impact both my blood pressures. It might impact my glucose, right? All of those things we know are metrics that can get better when we do lose weight. So great, we're going to be happy about that if that's where it goes. But it was like, how does it feel to make these minor changes that are ultimately healthier choices? What I remember also is that, and I don't know if I'm remembering this correctly or not, I feel like at one point early on, maybe you thought exercise was going to be a bigger challenge for you to implement than a couple changes, and then you shocked yourself and me by just like giving it a go and then loving it.
Yep, that's exactly right. That's
Okay, got it.
exactly
I was
right.
trying to
Yep.
remember how that played
Yep.
out.
Yep.
But
That's
that
exactly
was
right.
super cool. And I mean, I've seen this time and time again, and the research really does bear this out, right? We need to use our muscles as a means of burning off glucose. So exercise is a great tool. I think the reason why I may err towards focusing on diet first is because you can't fix a bad diet by exercising. Like people can still be unhealthy who exercise. And so I think, generally speaking, the harder change is diet. I don't know. I don't know what you think at this point with a little bit of hindsight.
Yeah, I think for me, the harder change definitely. I mean, I love my carbs. Like it's a thing. My relationship with food is also, food equals comfort. And, the job that I do often, there's some late hours, there's schedules running around, there's days where, you're in back-to-back meetings and you can barely get any time up to kind of have a proper lunch in that sort of way. um so it's, I was surprised that exercise came easier as well.
And
But
what
yeah.
happened was, if I'm not mistaken, you you started to make a few minor diet changes. And like some things were easier than others, and some things you would do for a little while and then you would slip a little bit and we would try something else. We were just always brainstorming, and that's one of the things I ask of anyone who works with me is, can we just stay in a mindset of experimentation until we hit on the right thing? Because that's all it is. I don't believe that there's a diet that's right for everyone. I don't even believe in the word diet all that much. It's like, where can we identify obvious lifestyle changes? So not that, I don't even know remember if this was one of your things, but it's one of many people's things. The very first thing I want from anyone is, can we cut down the amount of soda or juice someone is consuming? That's the very first thing I'm going to try to do. Most people are willing to do that when they look at all the other options, but there could be a person that's like, that's the thing I love the most. No, I can't do that first. Okay, fine, no problem. That's totally cool. So it's
Yeah.
just a matter of finding where we can tweak things. And I think for you, things that took time and energy were hard because you have a very busy life.
Yeah, that's exactly right. Yeah. That and desserts. I definitely have a sweet tooth. That was a big thing. But because we would have dessert, like 4 cookies, ice cream, not all those things at once, but every night there would be like a little something sweet after dinner, a little treat. Why not? It's been a long day. And it was interesting because like some of the things that we did was like, okay, this week let's have it be fruit or something else. This week, maybe desserts are just the weekend, or X amount of times. Or if you want something sweet, have it a little bit earlier in the day, because looking at your glucose levels, your body's responding much better when you have these sweet items earlier in the day as opposed to when you have them late at night, because that I would always end up with the morning spikes. And it's funny because like I got to a point where like I didn't even crave the dessert anymore. Like my husband would be eating, a cookie, and I'd be like, eh.
I remember
um,
you had a
yeah,
good long phase of being like, oh, I just have a bite of his. And I was like, what, who are
yeah,
you?
yeah. Or we would share something. Like that was never a thing that we would do before. Or I'd be like, I'm full from dinner. I'm all set.
Okay.
Or I'd have like protein. Yeah.
So here's something else I'm just remembering, and this is going to tie into like you suddenly being pregnant, which was like we were moving in that direction, but it just happened so easily and fast for you. Um, I'm trying to remember. There was a point at which you started to lose weight kind of fast and furious, and I was like, whoa, this is like really happening. Like you were surprising me, you were surprising yourself, and it wasn't too much, but it was like, I was just looking back at notes, like there was a phase where you were losing just over a pound a week, which was not any sort of a goal I'd set for you, but it was what was happening. And do you remember much about that time when it was just, it's sort of, you got into a groove and it just started happening?
Yeah, I think that was especially when we started to I really identify the things that were working for me, and the things that were good solutions for the I don't have time to cook issue that I was having. finding good alternatives for that, as well as me realizing that I really enjoyed Zumba and finding an instructor that I really loved. I think those things and how you helped me kind of navigate making some small tweaks to things that I was doing. I think the combination of those things was really impactful for me.
Yeah, totally.
Yeah.
And so you were like all in, you were losing weight rapidly, and then you told me I'm pregnant.
Yep. Yep. I remember I took a picture of the stick, I think. And I remember my hand was shaking and I was texting you like it's happened.
Yeah, I remember
Yeah.
being stunned too because like
Yeah.
it's not that I didn't think you could get pregnant easily and rapidly, but we'd just kind of gotten into this mindset I think we might have thought like we're going to do this for a year and then we'll do that. Like we just kind of got into a groove where we made a decision about what was going to happen without thinking about what was possible.
Yeah. Yeah. Yeah.
Okay. So, how did you shift things for yourself once you were pregnant?
Yeah. Yeah. That's a great question. I think for me, um, once I was pregnant, like my first trimester, um, I think it's because I just wasn't hungry, which is like probably not anything to ever say. Like, as opposed to being like really nauseous, I just wasn't hungry in the morning. So I ended up like losing quite a bit of weight during that time. And I was initially very concerned about it. And we were able to work together on, finding things that I could eat, being strategic about what I could eat, what I was eating, to make sure that I was getting the proper nutrition and everything during that time. Um, but I think also, once I found out I was pregnant, it was also like another box opened of just, uh, thing to cause anxiety after thing to cause anxiety after thing to cause anxiety. Like between some of the things that you mentioned already around like my blood pressure, the fact that I had prediabetes that would likely turn into, possibly gestational diabetes, which it did. Um, the fact that, I had lost weight, but I was still at a BMI where people would consider that to be high, of course. Um, and then my age, where I was technically, quote unquote, a geriatric pregnancy, plus the fact that I also had these fibroids, plus the fact that when we did genetic testing, I found out that I was a carrier for Duchenne's muscular dystrophy. And, what would that then mean if we had a boy? um, you know, the, and then all the possible cardiovascular implications that come with me being a carrier. So for me, it was like, not only was there the, how do I, maintain all of the things that I'm doing and stay healthy, but then everything was a concern. And I think, that's where working with you kind of definitely um, uh, was really, it's always been helpful, but especially like the additional knowledge that you have as a midwife, and the fact that anytime I had a question for you, your responses were always evidence-based, or even, your transparency to say, hey, that's an area that I don't necessarily have a ton of expertise in, curious about it, love to get you an answer, let me look into it. And then you come back the next day with like articles that you found and or peers that you spoke to. Like, it really went a long way towards, calming me and making me feel supported. Um, so I really, really appreciate, how our work kind of shifted in that sort of way once I did get pregnant.
We hope you're enjoying the Mother Wit podcast. If you are, please rate us and leave a review in iTunes, Spotify, or wherever you're listening to your podcast. Thanks so much. Now, back to the show.
Yeah, and I think what was happening for me was it was this wonderful opportunity to provide a layer of midwifery care to someone who I knew wasn't going to get it otherwise, right? Like there are many people who a doctor will say, this just happened to me today, just today with a client who I've had forever also. She's actually somebody who I've known since I was still in clinical practice in New York, who stays in touch with me. She has been told she needs to see a high-risk doctor. She's newly pregnant. And I'm not going to get into her story, but I disagree. Like, what she has is something we midwives continue to take care of people for all the time. And we know exactly when to say, hey, I need you to have a visit with my OBGYN that I work with, or I need you to see this high-risk specialist once. Let's hear what they have to say. He may say, I'd like you to be seen ongoing, and then we kind of work together. And that's definitely one way in like not like what I'm doing now isn't real, but face-to-face, in-person clinical practice that we function. But now what I get to do with people, and again, you gave me this wonderful learning opportunity to really like hone the skill with you. You would tell me what was going on at the visits. You would share reports, everything. And your doctors, if I recall, were like totally game. And I was a little worried, like, are they going to be like, who is this kooky midwife she's talking to? Like, what the heck is going on here? They kind of figured out pretty quickly that you were being successful. You were having success after success, and some of that was coming from what we were doing on the side. And so they supported you in continuing to have this dialogue with me. And that was really, really wonderful. So with all of that said, what I was trying to do was make sure that you were getting all the like love and TLC that a person having a low risk pregnancy always gets, while simultaneously being the touch point of somebody who would take the time to explain something to you calmly and carefully until you felt comfortable with it, kind of the way we just unpacked at the beginning, that fibroid discussion. The way I would have that is so different from the way they did. So we would do that with every single topic that came up, and we would check in. How are you feeling? How did that go? Like when you had your CVS, right? Like,
Yep.
putting your hand through all of these experiences where in busy New York City clinical practice with an OB or even a midwife, you don't hear from them checking on you. They just kind of get the report a few days or a few weeks later, and then they call you and tell you, hey, everything's normal. And it's almost an afterthought, right? You went through all of that worried for weeks all on your own.
Yeah, absolutely. And, I was very fortunate that I did have a really great, OBGYN who also appreciated your work, who also looked at me, as a whole, and was taking that holistic kind of proactive approach to my health. But like you said, the timepiece is a factor. Like there's, she's, has always had a good response time, but there was definitely, a level of an open door because of the way we were working together, because of the relationship we had together, that, enabled me to, always feel like no matter how silly my question might have been or how concerned I was, like I could always, text you or look forward to our session to kind of unpack a lot of these things. And it also did give me peace of mind, to hear, things that my doctors were saying, and then hear you echo the same things, or hear you say, hey, you should probe on this a little bit more. And then they're being like, yeah, I'm glad you did ask that question. So I feel like, it overall, I feel like, our work together was a great companion to the in-person care that I was getting, and really kept me sane throughout my pregnancy.
You just said something that I'd never really thought about in this way. One of the shortcomings of in-person care, as things have just gotten busier and busier and more about the bottom line and seeing as many patients as you can in a day, one of the things that I've seen is if a patient doesn't bring it up, I'm not going to, because I don't have time to open that door. And I've been that person, and it feels terrible. But at some point, you just turn that part of your brain off because you can't survive it otherwise. And I think that's why I had to leave full-time clinical practice, because I didn't have a great mechanism for just turning it off. I kind of died a little every day when I let someone leave my office, and I knew how many things I left unaddressed that were bubbling right to the surface. And I think that that's what's going on there. And that, from that place, though, I think is why they were so open and accepting to what we were doing. Because, again, there was no denying the benefit to you. And I think, now I kind of want you to tell us a little bit about your birth experience, because of course, like the pandemic hit when you were, 4 months pregnant?
Yep.
Like, take us through some of that and how, because I think I don't remember the details, but I think you had a pretty stellar birth experience as they go. And I wonder what you would say to this. I feel like people in your situation who have a medical history like yours are often made to feel scared through much of their pregnancy and even what might happen to you in the birth. And I'm not suggesting people don't deserve to know what could happen, but I'm also just not sure that fear-mongering is the right approach. So I'm sort of wondering, how was all of that rolled out for you as you got closer to birth? How did the pandemic affect that? And then tell us a little bit about your birth experience itself.
Yeah, happy to share. So I think for me, a lot of like what was helpful in our work together is that we talked about a lot of different scenarios and how we would manage those scenarios, and some of those scenarios did play out and a lot of them didn't. And I think because of like, for instance, preeclampsia was one of the things that was a definite risk. My OBGYN was proactive about that. Our work together was also proactive about that, in making sure that I was taking my blood pressures and everything like that. And we were monitoring and working on that. So like that was something I didn't develop, but I did eventually end up needing insulin. And as we got into my third trimester, I needed more insulin. And that's essentially one of the things that did come to pass. But when it happened, I was prepared for it. Like, I didn't feel like, this is it, it's all over, like, or anything like that. Because we prepared to kind of have that work, or have that happen. And we prepared in the case where those things did happen, what we could do. And then the vast majority of my pregnancy, aside from, I was high risk, so I was also seeing a maternal fetal medicine special, MFM as well. Like the most, aside from all these health things, the pandemic was happening, and that was very stressful. So I was fortunate that, my husband did get to go to some of the earlier appointments with me. But towards the end, like, I had to go by myself to all of the appointments, which was hard, because those are some milestones that, you're supposed to be able to do together. And there was definitely a lot of uncertainty when everything was happening, and we were doing the CVS, trying to understand if my son was affected or not with, Duchenne's muscular dystrophy. But again, like, in those moments of fear, in those moments of uncertainty, like, being able to also, like, go back to you and say, this is what happened today, and share some of those things with you, in addition to my husband, is really important. And then leading up, once we got into my third trimester, for the most part, like, my pregnancy, aside from those things, felt to me uneventful. I feel like if I wasn't prepared, getting gestational diabetes would be very eventful. But I knew that was something that could happen. We were prepared for it. And I knew going in, there was probably a likelihood that I would have to be induced. And I was induced at 39 weeks. And there was a moment where the doctors were considering inducing me at 38 weeks. And we had a long discussion about that. And that was something that I didn't feel like was 100%, didn't feel 100% right. And you gave me the tools to have that conversation, and my OB was like, yeah, no problem. So that was great.
Amazing. Sometimes you just have to ask for what you want, right? So
Yes.
I am spending a lot of time these days talking to people about advocacy, because there is an art to that. And we can argue with our providers all we want, but, like, do you really want to be in labor arguing? Do you really want to we just don't want it to be like that. And the truth is, most of the time when you say what you want and you state the knowledge that you have, they're like, yep, can't argue with that.
Yeah. And it's also like, because of you're also coming at everything, we're having worked with these providers throughout your whole career, you know, you also came with tips on how to approach them, like going to them and saying like, this is my birth plan. Like, birth plans like that. I mean, I'm not knocking birth plans, but like, who can plan a birth? Nobody can plan a birth. You can have preferences. You can have, you know, things that you want to happen, things that you've considered, but just going in with that, my own mindset that I can't plan this birth. I need to be open. I need to be prepared. And then also presenting it to, I remember we worked on our, my plan together, and presenting that to my OB as like, hey, these are my preferences. I understand, you know, things happen. I think that information just got received in a way that was much more palatable to her, and you know, helped her really hear me, as opposed to, you know, not, I don't think she would see me like this, but I know some healthcare providers could see you as like, oh my God, you know, this person, this is going to be a difficult one, especially going in when I was giving it to the labor and delivery unit. I know that there's the possibility of being kind of seen that way there, and I wanted to have, you know, these are the people that are going to see me in my most vulnerable moments. So to be able to kind of establish that relationship on the right foot was really important to me, and you know, you giving me the tools to do that was really helpful.
You know, I had forgotten until now. You know, I love that you're calling them tools. It sounds so much more professional than what I think I really did, right? Because what I really did listening to you, I'm like, wow, she actually remembers a lot of what I said that I don't remember. But what I'm hearing that I did was I gave you the inside scoop.
Yeah.
And you needed it, and people need it, and that is what I do. And I guess those do become tools. But you know, the main
Yeah.
point of what you're saying, that resonates with me so much is going from the phrase birth plan to birth preferences is like the subtlest of subtle changes, and it shows us why language is important, which sometimes I need to remember myself. You know, it's so subtle and so powerful all at the same time. And it
Yep.
tells someone that you're flexible. And I've been the provider who's being beat over the head with somebody's birth plan. And inside, I'm thinking, and this is obviously the conversation we had, I'm thinking, oh my gosh, this person is so rigid, they're never going to get the birth they want. So,
Yeah.
and I can't change someone from that seat, right? When I'm in that role that starts to look patriarchal, even though I'm a woman, that's what it is. The medical system is patriarchy. And so I get seen here, and now we're just like butting heads. But I'm just trying to say, oh my gosh, if I had more time with you, I could have helped you see this experience in a more flexible way that would probably give you a better odds of success, because you wouldn't be framing success so narrowly, and everybody would be on the same team instead of on two different teams. So it's funny because I don't remember this conversation with you, but I can hear my own words, and I'm amazed at how much of it you've
Yeah.
retained.
Yeah, and it was helpful for me too, like just shaping like how I was talking about it, how I was talking about what I wanted, what were the kind of clear things where I was like, there's no way, or you know, like, please try everything in your power to not have this happen, versus like, this is something I would like, but if it doesn't go that way. So like, what were those areas where things were the hard lines versus shades of gray? And for me, going into the birth, that was really helpful, because like, you know, this is my first child. I've never had a baby before. I was induced. And once my water broke, like my contractions were like, I did not expect that they would feel that way. I mean, I don't know why. It's not like I thought they would feel like nothing, but my body was like just violently shaking. My blood pressure was also shooting through the roof. And on my birth preferences was that I didn't want an epidural. And in that moment, I was like, you know what, if I'm going to get through this, and like one of the harder lines was that I would really like to do this, you know, I would really like to give birth vaginally. That was one of the harder lines that I drew. So being able to define where I had a little bit more flexibility than others, of course, being open and flexible throughout everything, kind of helped me be like, okay, I need to get this epidural. And of course, you know, that's what worked for me. Like, kudos to everyone who can definitely do without. But like that, the minute I got it, my blood pressure went back down. I stabilized. We were able to find my son's heartbeat again because he kind of kept going on and off. And I mean, who knows what would have happened, but I really do think if I remained bullish on that, I probably would have ended up with the C-section. Yeah.
I love that you just framed that, because that's another thing I spend a lot of time talking about. While I am beyond happy to support people in a totally unmedicated birth, we really have to be careful not to vilify the use of an epidural, because an epidural, when in a good midwifery practice or even good obstetrical practice, is honestly a tool to a vaginal delivery for a subset of people, especially having first babies. And so if we can really be careful about framing, like, a vaginal birth is more important than birth without an epidural, especially in this case, like what you described with your blood pressure, and just listening to the story as a provider, I'm like, is she having high blood pressures because she's in pain and or anxious, or is this the beginning of preeclampsia, right? Well, the first thing we need to do is rule out those first things I mentioned. And how do we do that? Let's take away your pain and kind of see where we are. And if we take away your pain and your blood pressure is perfect, I think we're okay. Maybe we do some labs to be sure, whatever, but now we're certain. And we're in a great place, and now you can just chill and have this baby. And how dilated were you when you got the epidural? Do you remember?
Oh boy, I felt like I was like, what, they're gonna check, they're gonna say like 5 cm. I think I was like 2 or 3. And what happened was, when they checked and I was like, I can make it if it's like 5 cm, I'm gonna see, I'll try to hold that. And when they said it was like that little, I was like, oh no, I can't. I really want to, but I in my mind, and I was working with a doula too, which was who was amazing, and we had that conversation around like the various paths. And I had that with my doctor as well, before I said yes to the epidural. But and it was my idea, like I was the one who was like, maybe this is what we should do, and I talked about my options then with them. But yeah, for me, and I know not every, all situations are unique, but for me, there was, well, the minute I heard I was only like, 2, almost 3 centimeters, I was like, I need, like, there's no way I'm gonna be able to sustain this.
And you know what? A first baby, this is something else we talked about. First babies and induction at the same time is a situation in which you need to give yourself grace.
Yeah.
And an epidural equates grace.
Yeah.
In many situations. And then, if I remember, like, you didn't push for a very long time to get this baby out, did you?
It was about 2 hours. I don't know if that's a very long time or not.
It's average. I remembered it. I definitely remembered it differently. I think I remember your, from the mountaintop success story in retrospect. Now I was just like, oh, she did so good, it was easy. But yeah, 2 hours is average, but it's a long time, no joke. So
yeah, no, yeah,
but
and it
all
was
that
not
went
cute.
smoothly.
Yeah, everything there went smoothly. And yeah, it was interesting because I do feel like, he came just when I thought I was like, is it here? like I don't know. Like, I don't know if I can do this for very much longer.
That's it. When
And
you say I can't do this anymore, you're almost done.
Exactly. And then I think what was helpful is my OB was like, do you want to feel the head? And when I put my hand down and was able to feel his head, I think that was like, oh my God, like we're so close. And that really also gave me the extra push.
Did you have the OB that you love so much for all your prenatal care at your delivery?
I did. Yeah. She was present. She was amazing. Yeah.
So happy.
Yeah.
That's great.
Yeah.
Okay.
Yeah.
So I'm not gonna ask you to talk too much about your postpartum experience, just because that's what I spend most of my time talking to people on this podcast about. But is there any particular moment or highlight that you feel like is really worthy of sharing?
Yeah. I mean, I think in my postpartum experience, that was another place where I needed to give myself some grace. But I had prepared so much to breastfeed, and we had done so much. We had a lot of discussions. You gave me resources. I went to webinars and everything. But you also prepared me for, here are some of the issues that may come up. And I was so excited. My son came out, And I was like, let's go. He's going to do the crawl. We're going to get, some milk. And he slid right off. He, had a lip and a tongue tie. And I think for me, it was crushing because I had prepared so much to do that and wanted to do that so much. But also, that's something that we prepared for. And it's something that when we were working together during my postpartum phase, you also worked with me on, that piece and still, figuring out how to be successful and navigating like the pros and cons of release and all that type of stuff. So I really, appreciate that because that was, something that we prepared for, but was not was something I wasn't anticipating would actually happen. Yeah.
Yeah, it's amazing. There's always things that, people, I've said this on many podcast episodes already. There's so many things that people say to me, I wish someone had told me this. And I have empathy for that person in that moment that feels that way. But oh my goodness, if I sat everyone down and told everybody everything that could ever happen, we would never accomplish anything in life and we would be shaking in our boots, right? Like
Yep.
there is this line where it's like, we kind of have to get a general sense of the possibilities and not get too attached to whether I know all the details about all the things, because knowing it doesn't change whether it happens, but just kind of, again, it's all about flexibility and malleability. And I mean, I hope that this skill has come with you through your parenting journey.
Yeah, it definitely has. I mean, I think that there are certain things that, that I didn't anticipate doing that I'm doing and vice versa. And, I think, you can't, like, my life is not just about me anymore, and I think also like you can't, like, this is another human who has their own feelings and their own wants and their own desires, and I'm blessed with like shepherding that person and trying to make them a whole responsible person in the world that we're living in today. But things change, things happen, and you just kind of have to, you know be prepared for anything, roll with it, do your research, and make the best decisions that you can for yourself and your family in the moment.
Yeah, and it gives you a lot of empathy, I think, once you are a parent for parenting, right? Like, do
Yeah.
you ever judge parents in any way, shape, or form before you were one, and now you're like, oh, maybe that was a little unfair?
Yes. Yeah,
Like,
yeah.
all right. So, in moving towards wrapping up, tell me a little bit about where you are right now in your health journey, and what it is you think you need moving forward. Because I just interviewed someone whose podcast episode will come out next week in relation to when we're recording this, and she referred over and over again to seasons in life, and I loved that expression, and it's been really sticking with me, talking about seasons, because it's kind of like in pregnancy we talk about trimesters, and even we have a fourth trimester to talk about postpartum, but like season, I love that language. And so you're like in a transitional season is kind of how I'm seeing it for you. And I'm just wondering how you're feeling about where you're at and where you think you're headed.
Yeah, absolutely. Yeah. So I would say my transitional season, I definitely have approached it like a bear in that I have stored some additional pounds to sustain me through my traditional season.
It is winter
No,
time and hibernating is like winter
I was
time.
hibernating, it's time and sun rays and changes. No, but I think that, being a new mom, going back to work, and kind of, coming off of some of the initial postpartum work that we were doing together, I was giving myself a lot of grace and space. A lot of the old things around not having time to prepare for food came back up, and I think what I've realized is that in reflecting back on my experience, we talked so much about making things sustainable, but I was, in retrospect, so focused on just having a healthy baby and having the pregnancy be healthy. And I think like I heard everything, And there were so many times we were like, you've made such good progress. Like, I know, once you deliver that baby, a lot of the weight because I didn't really gain weight during my pregnancy, aside from the water weight and the baby weight. I gained maybe like 2 or 3 pounds. It was not a lot. You're like, you're going to be like amazing, set up for success. And like I was, but I focused on life and I lost myself a little bit in the process because I met that goal. Like I had the baby, like we were both fine. And I think like now that I'm kind of coming out of this transition period, trying not to kick myself too much on doing some of the work that we've done together. But, I need to kind of shift that to just thinking about, a sustainable, a long-term approach to wellness. And how do I start to kind of, probably unpack some of the things that I have around food as comfort, to be honest.
Well,
yeah.
And in listening to you, the first thought I had was, shoot, getting pregnant, having a safe and healthy pregnancy was her big motivator. What in the world am I going to use as a motivation now is what I'm thinking, right? But it just came to me, baby. And that is like, we've talked about this already, but I think this might be like the new framing point. You want your toddler to grow up with really great, healthy habits. And we've got to start modeling that now.
Yes.
And I think maybe you're considering another pregnancy.
Yep. So that could be, if we go that way, that would be an immediate goal. But kind of like having my eyes open now, I think that's right. Like modeling that behavior, and also like not to be morbid, but being there. Like, I'm about to, I'm going to be, 39 this year, which is not old by any means, but it's also not the super young 20-year-old that could just eat burgers all day and run around and enjoy her life. So I want to be there. Like I want to, do all the things that you want to do and see your child thrive and with all of the underlying health conditions that I do still have, that will get better, but not fully go away and just be kind of more manageable. Taking care of myself is also taking care of my family. And I think I just need to remind myself of that. So I've been so focused on them and not as focused on myself.
Hope this move for you is a move that once you've settled in allows you to have a little bit of a slower pace, because that is what's going to allow you the space to do the things that take a little more time and energy up front and have the greatest payoff. I think that's for most city dwellers an enormous piece of the puzzle. Like you're just so not alone in that. So I really hope that as a consequence of this move that I know had some beautiful, thought behind it, but also is bittersweet, right? It's hard to leave your forever home that you've always known.
Yeah, absolutely.
But hopefully that's part of the good that will come out of this.
Yeah, absolutely.
Oh my gosh, Chantel, it's been so lovely getting an hour of your face and your voice again. I
likewise
enjoyed talking with you, and I'm so grateful to you for sharing your story and really reminding me of the work we did together that I have again always been very proud of, and I just thank you so much for trusting me as much as you did. I really appreciate it.
Absolutely. Thank you for having me today. It's been great chatting with you, and thank you for so much for supporting me in the way that you did and responding to all my frantic texts and always giving me the safe space to bring my true self and any questions I had, and also knowing when I needed a push and when I didn't. I really appreciate you.
Thank you so much. Hey everyone, it's me, Tanya, your host here at the Mother Wit Podcast. I sometimes invite my clients on the show to talk about their birth stories and postpartum experiences, but I want to tell you a little bit more about what those clients and I actually do together. I started Mother Wit to help people in the perinatal period achieve their health and wellness goals. That means whether you're hoping to conceive and struggling with high blood pressure or high blood sugar, or you're having trouble managing anxiety or depression in the postpartum period, or maybe you just need support and advocacy between prenatal or postpartum visits, I can help. Get a discount on your first consultation with me at motherwitmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. I'm looking forward to working with you and maybe having you on the show too.